This is Pediatric Cancer Part 3, and we're going to discuss assessment. When a child presents with cancer, in general, it is not staring us in the face, so to speak. There are signs and symptoms that can be related to many other things that go on with children. And so we keep cancer in the back of our mind, but it's not in the front of our mind. So we have what we call overt signs and covert. So overt is, yep, I could feel a mass. That one's staring us in the face. So we're going to go over the overt signs. So first of all, the palpable mass. Now, believe it or not, I have had physicians who have completely missed the palpable mass. And it wasn't until the child came in with a stage 4 tumor was it diagnosed, and it was never diagnosed by her pediatrician. There can be purpura. Now, what other illnesses have we already talked about that present with purpura? Hint, hint, remember those communicable diseases and meningococcemia. A child can be vomiting in the morning. Well, heck, kids vomit all the time. What's a little vomiting in the morning? Well, there you have it. It's in the morning, and it's every morning. That's what's not normal, because you know that when a child has some type of gastroenteritis, they're not simply vomiting in the morning. They're going to vomit everything for a day or two, and then they're going to get better. But a child who may have a brain tumor, they're not getting better. Unexplained weight loss and unexplained fevers, very typical of adult cancers as well. The weight loss may not be as obvious until they actually put the kid on a scale when they come into a doctor visit, and all of a sudden they're like, oh my gosh, they've lost 10 pounds. I didn't think that how could they? That kind of a response. And then the fevers, it's not as though they're having a 102, 103, 104. It may just be a low-grade fever. So this child, especially in the afternoon, is having these fevers, or in the evening they're having fevers. And mom might feel the head and, oh yeah, you're feeling a little warm, and just give Tylenol without ever taking it, because after all, God gave us a thermometer in our hands, right? Just kidding. And then we have another overt sign, the white reflex in the eye. We should have a red reflex. You've all taken pictures where you look at the pictures and you say, man, they have the red reflex there, and you want to get rid of it. But when there's a white reflex, this means that there's a tumor in the eye. Our covert signs and symptoms. Covert means covered or nonspecific. Bone pain. So why would a kid complain of bone pain, and what would be the response by the parents as well as the pediatrician? Oh, bone pain? It's just growing pains. Headaches? You're just under stress. Fatigue? What teenager doesn't complain of fatigue? And then they have malaise. They just don't feel like getting up and doing anything, but boy, they can still do their video games. But doing video games all the time doesn't mean that they're feeling okay. They're doing that as a distraction. And then other things can be the change in the balance, gait, or their personality. So you have a kid who was very even-keeled, and now all of a sudden they're having behavior change where they are getting angry, or they're crying all the time, or something like that. But who's thinking of cancer when a child has that? The change of balance generally means that we have some type of a tumor in the brain that's affecting the cerebellum. And then persistent lymphadenopathy. So in order for us to actually find this, you have to put your hands on and feel them. Well, what parent is doing that unless they're giving their child a bath? Our assessment is going to vary on the type of cancer. What are they going to present with? So we can have neurologic changes, and these are going to be our brain cancers. Loss of developmental milestones. So remember, I believe I said this in the very first week under physical assessment, loss of previously acquired milestones is a red flag, and we need to figure out what's going on. A child can have change in their speech, the headache and the vomiting, very typical of brain cancers. And then, depending where the cancer is, it may be compressing the optic disc, and now the child is complaining that they're having vision changes. Our blood cancers, the child becomes pale, they're tired, they have purpura and easy bruising. But what's amazing is they don't have any of this until their hemoglobins are about 6. And so the parents bring them in like, Johnny just isn't right. There's just something unusual because it's an insidious, as in slow onset of these symptoms. And the parents don't necessarily notice it. It sometimes takes an outsider who'll come in and say, "What the heck's wrong with Johnny? He looks so pale and puny." And then the mom will look at him like, "Really? I've been looking at him and I was wondering if there was something, but he's still out there playing. He's still doing this and that." And then they bring him into the pediatrician. The pediatrician takes one look and then does a finger stick and says, "You know what? You're going over to the emergency room right now." Not even telling them what's wrong, but just the blood count is really low. We're going to have to evaluate the kid. And so the mother and the father, they're worried, and the kid is looking at them like, "What's going on here?" They take him to the ER, and within 24 hours, we're telling them, "Your child has leukemia." And then we have our solid tumors. This picture on the right is the demonstration of that abnormal light reflex. So when you look at the eye on the right side of the slide, that's what you expect to see. But when you look on the left, you see that white? That is actually a tumor that's sitting on the back wall of the eye along the retina. There can be a palpable mass, and I'll never forget this one child who was 4 years old. Her mother took her to the pediatrician so many times, saying she's complaining of belly pain. The physician listened to her tummy, did a little push, and said she's constipated. Gives the mother the whole regimen of what to do to get her stools going, and the mom is looking at him like, "Well, she is pooping. I don't know that it's constipation," but she goes home, follows the instructions. The kid is still complaining. So she goes back and she goes back and she goes back until all of a sudden the pediatrician really palpates that abdomen. By now, this tumor is occupying the entire abdomen. So look at this x-ray picture I have on the bottom. And you can see that this is a nephroblastoma, meaning the kidneys have a tumor, and this is bilateral. When you look at the kidney on the left side, that is completely taken over by the tumor. And then on the right side, the dark area, that is tumor. The white area is the normal kidney. And so when we palpate this kid's belly, they're going to look distended, and this is an encapsulated tumor. You have to be careful when palpating. In fact, the rule of thumb with the Wilms is definitely palpate softly, because if we compress too much, we can rupture the tumor and it seeds all over the abdomen. So a child will have belly pain. They can have groin pain. When they have testicular cancer, they have groin pain. They can have pelvic pain when they have an ovarian tumor. In the spring of 2015, when my group was at Chalk, we had a girl who was 12. And she looked like she was 7 months pregnant. She'd lost weight, and her parents noticed, "Oh, her belly is sticking out a little bit." They didn't have insurance. They waited 2 weeks, and this was a very rapidly growing ovarian tumor. And she was a stage 4 ovarian cancer at the age of 12. Very sad. So anyway, this ends the lecture about the assessment, and it's more like the presenting signs and symptoms of cancers in children.